Happy, beautiful, amazing day. Dr. Bob Rakowski here with an amazing guest, Dr. Atousa Mahdavi. We're going to have a brilliant conversation. She's a best-selling author. She's a clinician. She's a professor. She practices what she preaches, living healthy, sharing health. Dr. Mahdavi, welcome on this beautiful day. How are you?
Thank you so much for having me. It's a pleasure to be here. I'm doing all right. Thank you so much for asking.
Well, I like to say you're better than all right, but sometimes when we practice like we practice, we can start a little controversy, or be in the middle of a controversy, even though we're standing on really solid principles. Let's talk about this concept of a paradigm. Stephen Covey made the statement years ago. He said, if you want small changes, change your behavior. If you want massive improvements, change your paradigm. So, do we need a paradigm shift in healthcare today?
I would have to say yes, we do. But it does start with changing the culture of medicine, not only amongst our healthcare practitioners and the medical system and through healthcare policies, but also through individuals to change their mindset about what is health, what constitutes health, and what are the tools that are more effective in long term. So definitely each individual behavior matters, and there comes the culture that needs to be changed at the grassroots level, but definitely at a policy level, systems, etc.
Yeah, that's going to be the fastest way to get the biggest change. But let's talk about how you go about working because you use timeless systems, use Ayurvedic medicine, you use balancing the structure, you use breath work. And by the way, chiropractic is much older than just 100 something years, right? It's many thousands of years old. But let's go through those. Where do you want to start? Ayurvedic medicine, chiropractic, energy, acupuncture?
I mean, either way, they're all holistic and they're all targeting the cause of ailment. So, one of the hallmarks of holistic medicine and the new paradigm would be to discover the cause of the ailment and address the cause and not simply masking the symptoms. So, whether we talk about chiropractic, that basically says that you have the innate system that is in connection with the universal intelligence, that the body knows how to heal itself when you give it the appropriate nutrition, environment, neural alignment, etc. And so that's chiropractic. Now, Ayurveda also has a concept of nidana. Nidana is the cause of ailment. And so, again, we try to discover the cause and alleviate the cause. Where are these causes? Well, generally speaking, it's in someone's um, daily routines, lifestyle, diet, nutrition, and environment. So basically, toxicity in the environment. Whatever is in your environment, including your home environment, office environment, in the air, in the soil, in water, um, furniture, the forever chemicals, etc. So when we say environment, we're talking about the toxicity that is introduced to our internal system through the external environment. And so I think both chiropractic, functional medicine, and Ayurveda mm, have the same philosophy of find out what is the cause, fix the lifestyle, diet, nutrition, detoxification, and once you discover the cause, and that would be a long-term approach that is effective and warrants results and longevity in the long run.
Yeah, I'm laughing at a joke I heard on a podcast the other week. Sometimes people think that they're being holistic in their healthcare when they bring the whole list of doctors they're seeing. Uh,
I
wha- I want to share a case and get your input on it. And I can share what I said because you and I speak the same language. So I have a patient. He's been a patient for over 30 years, moved away for a period of time. I hadn't seen him in a decade. And when I saw him last time I saw him, he was in good shape, fit, healthy, good diet, exercise routine, etc. All of a sudden, he comes in, he's about 25 pounds over fat. He has no energy. He hurts everywhere. And I looked at him, I said, "What in the world is going on?" He says, I just wasn't feeling very good. I went to the doctor. They told me I'm diabetic. I have high cholesterol. I have high blood pressure. And, they put him on 3 different meds for that. And I said, "Well, how did that happen?" He says, "Well, I stopped exercising. I stopped eating right. Next thing you know, I'm drinking too much beer, eating too much pizza." So I looked at him, I said, "What do you think the answer is?" You know? So I'm imagining you see that often. So let's bridge that with paradigms. Someone goes to a doctor, they're not feeling well. What does the doctor do and what's their first defense? And how do you do things differently from that? Let's
Okay.
take the same case.
So the first simple answer that when someone walks into my practice, they shouldn't expect a 10-minute, 15-minute, 5-minute consultation. They're going to expect a 90-minute consultation. Yes. So because that 90 minutes, it's going to give me an overarching understanding of their entire lifestyle, including daily routines, including their work, including their stressors in their life, including their environment, diet, nutrition, obviously, medical history, etc., etc. So that's the number one difference, that if someone is seeking a doctor or practitioner that is starting on the at the very first level, um, on a thorough evaluation and examination and consultation. That's the hallmark of a great doctor, a great practitioner. Unfortunately, many medical doctors that are stuck in the insurance system are only spending, if you're lucky, 15 minutes with you. Your general practitioners, your family doctors, internal medicine. And that's hardly enough to, get 5 minutes of that is writing the prescription, like 5 different meds. So, and then during my consultation and evaluation, like I said, I'm asking all these questions, which then I can put it together in a sense, and I'm sorry, and figure out what is the cause of their ailment as far as their diet, nutrition, lifestyle is concerned. So that's the first step. That's one of the main important uh, considerations, is the doctor trying to figure out what in your lifestyle is causing your health issues, and then accordingly address it.
Well, how brilliant, right? So what you're suggesting is some random accident just didn't happen. This person one day was well and suddenly became sick. It's no, they earned it through the choices that they've made, essentially, right? Good or bad. We were taught in school way back when that if you took a good history, you ought to be able to get 90% of the way you need to get with where you're going with patients. So, you know, why do you think it is that doctors, you did mention the time element, but is there more to it than that? Why are they not taking the time to learn what's going on with the patient?
Why aren't they taking the time when one is the system is designed that way? Like, if they're gonna pay their student loans and if they're gonna pay their overhead and office staff, etc., and be within the insurance reimbursements, etc., they have to see 30 patients, maybe 50, 60 patients a day. Uh, but that's number one. Number two, they're not trained that way in medical school. So their training doesn't include nutrition, diet, lifestyle medicine, energy medicine. Their training, their education doesn't include any of that. So we cannot expect them to understand the intricacies of causation, right? Now, some of them understand it. They know, well, if you eat better, if you sleep better, if you exercise, etc. But they're also not trained to take the appropriate dietary questions, lifestyle questions, etc. Yes, they take medical history, and that usually is before you see the doctor, you're filling up the chart. Uh, okay, did you have this? Have you had this? Have you had these surgeries? Have you had this? What medications? And if you're lucky, maybe the doctor will review that 2 minutes, either during your consult or before you go in, etc. So the whys are numerous, I guess, but some of the most important ones, I believe, are the ones that I just mentioned. And also it used to be, and I'm gonna post this like maybe today or a few days from now. There used to be that people who got into medicine, like medical doctors, um, 100 years ago, 150 years ago, they really did it based on their humanitarian love for embarking on a journey of healing, right? And they really, that was their number one goal. But unfortunately, as the culture globally has changed towards more wealth, success is defined as financial wealth, then they have lost that initial intention that was, well, I want to be a doctor because I really want to help people. But then with the student loans, with the cost of living, lifestyle, and the lust for wealth, and not that having wealth is wrong, but the approach, once health and medicine becomes a financially driven system, it takes away from the noble intentions. And I think we've lost that in medicine. There are still doctors that care, but they're stuck in this system.
So the things that you talked about, diet, exercise, stress management, lifestyle, energy, I think if we asked 1,000 doctors how many chronic cases patients can get better without addressing those. I'm just going to ask your opinion. Do you think any doctor would say, "Oh, they can all get better without addressing that," or do they realize no one gets better until they address that?
Correct. Correct. Honestly, um, I don't have much faith in the understanding of the medical doctors. That they do believe that they're helping with chronic ailments, right? We saw that the insistence of during 2020 and 2021 and onwards with certain insistence of the mandates, and most doctors were pushing on their patients, etc. It's because it stems from their belief that they're actually helping even chronic ailments, and therefore any intervention that comes from the above they have to implement, and they have to stay in that box. So I don't believe that a large a number of them are going to say, yeah, we don't have answers for chronic ailments. Some of them are coming around since 2020 for the most part, and understand that they don't have solutions for chronic ailments. Acute, yes, I respect medicine for its place for treating acute injuries, trauma, acute infections, bacterial especially, parasitic especially. Um, Emergency medicine, I totally respect that. Certain surgeries are life changing, saving lives. I totally respect that. But when it comes to chronic ailments, conventional medicine has failed. And that's, I think, not only something that I say, but I think the evidence is out there. Um, we've, you know, throughout the past few decades, we've had increasing rates, incidence, and prevalence of chronic ailments, even though we say and they say that there are advancements in the field of the medicine, the new technologies, the new interventions, but still the charts don't support that. We have an increasing number of chronic ailments, even amongst children. So
Yeah, I think that's the scariest thing about what's going on out there. So since we went back to the 2020 pandemic, everything went on with that, what was your top lesson from that period of time? What do you think you learned as a practitioner, maybe about yourself, your patients, and your colleagues? What did you learn?
I pretty much already had lost faith in the the conventional medical system. I had already lost that. That's being a chiropractor for 30 years. But suddenly I realized that perhaps we're reaching a critical mass of people, individuals, even doctors realizing that the system is not working. So it was hope, but also a sense of urgency and a sense of clarity and certainty that the system is not designed to heal. The system is designed to hurt. The system. I'm not talking about individual doctors, etc., etc., because commercial medicine has been captured by special interests, corporations, big pharma, etc. And so I guess the level of my certainty and clarity just went up to a completely a different level. But then it brought me in contact and connection with few medical doctors that were in the know, and they started speaking up and they started putting out the science. And I really started having reverence for those medical doctors that actually still abide by their Hippocratic oath and are actually honest and scientific based and are in the forefront of bringing this awakening into after 2020. And then gradually I noticed that the critical mass of people is reaching a level that now they're respecting holistic health, alternative medicine doctors a lot more. They're coming to us a lot more frequently. And I believe that is what I started resonating with, this paradigm shift. Paradigms shift when there is a critical mass of awareness asking for a change. And I think we are there. Now, whether or not we can combat or we can overcome the obstacles, the resistance from the system, I'm sure in the long run, yes. In the short run, it's going to be challenging.
Yeah, Casey Means wrote the book Good Energy, and I was listening to her on a podcast. And she basically said she's convinced now that in the system, as you describe it, doctors are paid to keep people sick. And so keep in mind, she was, nominated for Surgeon General, and I don't know that she ever make it through that approval process. I don't follow politics that close, but she made a very good point. By the way, I was also listening to a podcast the other month. It was a very famous medical doctor, and the podcaster asked him, "Would you encourage your kids to get into medicine?" And he said, "No way." And the doctor said, "Why not?" He says, "Well, AI is replacing medicine, but maybe the type of medicine they're doing, but there's no way that AI can replace chiropractic, acupuncture, Ayurvedic medicine." So speak to that. Speak to the infinite intelligence of those arts and how it takes a human to apply them.
Absolutely. I mean, for example, Ayurveda. Ayurveda is such a vast knowledge of the human system in harmony with the laws of nature that even once someone stops, like meaning their education stops in the department of Ayurveda or in the field of Ayurveda, their knowledge continuously expands based on new understandings, based on numerous herbs and combination of herbs that can impact health, etc. And it was a science that was passed from a teacher to a student. It was one-on-one. It was hands-on. You had to, shadow your teacher for years and years. It was an honorary system. It wasn't so pretty much and also a lot of it is hands-on. Like for example, you have to take the pulse. Taking the pulse in Ayurveda is such an intrinsic um and delicate uh approach. It takes years to become masterful at it. How could AI take Ayurvedic pulse or acupuncture pulse? How could AI do the chiropractic adjustments etc.? Can AI do consultations? Can AI give you answers about nutrition? Yes, but nothing replaces the human intelligence and the human soul. And perhaps it can replace the medical system and the medical doctors. Can we say that some of them look like they don't have a soul? So therefore they can be replaced with AI? I mean, what is a soul? That connection with the divine, with the creator, with something outside of us that is all knowing, all present, has within it the capacity to do miracles, to change destiny, etc., etc. That's the soul's connection to the divine. If something blocks that connection, you could say that individual has lost the capacity to have the understanding or the discernment of what is human, and their, human heart, compassion, love, putting your patient's well-being above all other motives, etc. In that sense, can we say, well, someone like that is lost those connections can be replaced with AI, but no matter, even when they weren't replaced with AI, they weren't doing you any good as far as chronic health is concerned. But even, that patient-doctor relationship that by itself could be healing, that is lacking when it comes to your relationship with AI. You know, the,
Or doctors in the wrong system, you know? I'm imagining a patient with a 90-minute consult with you. They might have an oncologist. They might be treated for metastatic cancer. They might have seen this oncologist 20 times,
yeah.
but I doubt it's been 90 minutes total. And that's what you're doing on the very first visit. And this person's fighting for their life. So, how wonderful that you're doing that. I'm going to take one moment and go to our sponsor real quick. And I want to go back to this ancient wisdom. So, brought to you by bettercoffeeshop.com, the world's cleanest reishi infused coffee. 94% of coffee, 94% have herbicides, insecticides, fungicides, molds, mycotoxins, heavy metals, microplastics, or multiples of the above. BetterCoffeeShop.com. Our coffee doesn't have it. It's reishi infused, certified organic, world's best organic coffee. So I like what you said about really, God working through our soul, divine intelligence, working through a human being and the part of us that's not human in a way to make every other human better. You certainly can't achieve that through AI. And I even think a system that gets the human out of it misses a big element of healing. So, how much and by the way, you've probably seen this many, many times. People go to, the right practitioner for them, they instantly get better. They could go to a similar practitioner, similar art, but it wasn't the right one from them, they don't get better. So how much do you think the doctor-patient interaction is related to the success of the therapy?
I feel that it's hugely important and hugely a factor. Um, in fact, in Ayurvedic ancient textbooks, it talks about that. It talks about the Vidya or the Ayurvedic physician's role in that healing connection with the patient. Aside from that, I'm sure you've had this experience that you have a patient walk into your practice and they tell you, as soon as I walked into your office, my pain vanished. Have you had that? I've had that experience.
Yeah, of
I've
course.
had that experience. Even as recently as a patient that saw me on a telemedicine at the university telemedicine. And years of chronic neck pain with limited range of motion. Of course, I gave some therapeutic exercise recommendations, some yoga therapy recommendations, some herbs and supplements, and even the chiropractic cervical pump home device, etc. So they went ahead to order all of that. But they, right after the consultation, when they went, they were waiting for the orders to arrive so they can start doing those. The pain was gone. This is as recent as a couple of months ago. So, and I'm not saying it's because of an individual healing ability or what. I feel like as true healers, we are a channel. The healing is with the patient. But when you channel certain um, love and understanding that miracles are possible, when you're connected with the source, to whatever you call your source, etc., um, that can be transmitted. And so I'm a big believer of that, that the presence of the doctor, an actual doctor with the patient is a big part of healing, the healing process, and it cannot be denied. So AI, whatever you want to say, however intelligent it does not replace the human soul, the human emotion, the human God code, whatever you want to define it as, and that connection with the divine. And they can try as much as they would like to, but I don't think they will succeed in replacing that.
Well, you are clearly wonderfully connected. What is your favorite strategy to help people get, connected to God, to divine, to infinite everything? Do you have
Yeah.
a strategy for that?
So I first aim to understand what are the kind of belief systems of my patients, because not everybody comes from the same belief system or religion or spiritual background. Some could be even atheists. And so I kind of tap into that. And then obviously, one thing that I use with everybody across the line, it doesn't matter what their background is, I try to have them understand the mind body connection. In my book, Holy You, which is available on Amazon, I have a chapter on health revolves around mind, body, spirit, or mind, body, consciousness. And I try to get that connection with them understood, mind, body. And depending on their background, I encourage them to uh, meditate on the words of God or meditate on affirmations. So if they don't believe in God, if something is blocking that, affirmations. If the mind is scattered, if the mind is constantly bombarded by negative thoughts, I teach them how to write down some sentences that can be short and can be memorized and do affirmations. Watch your thoughts. So, mindfulness. Watch your thoughts. As the thought comes, breathe. Bring in your breath awareness. I teach them breathing practices, pranayama, etc. If they believe in a God, I ask them to really deepen their connections with the divine and pray, but not pray in a begging sense. Pray in the sense of you have been given authority over this, and God has given you that authority, that you pray with expectation. And it is done as it is done already. And that what you're asking, your health, etc., it's already done. You pray in those, sense of it's already done. You're just putting that out there. And yoga therapy. And in yoga therapy, the sequences are designed based on the patient's condition, constitution, etc. And like I said, the connection part, uh, the connection with the soul or with the spirit, etc. I try to also demonstrate how important it is to have a purpose in life, to have meaning in life, because without a meaning in life, your joy is stolen. If you don't serve a purpose higher than yourself, if your work is not attached to a sense of purpose, no matter what you do, no matter what you do, then that takes away from joy and it brings misery. You're a waitress, you're a delivery person. Try to connect as many good things that delivery is bringing to your client or to the person you're. Every profession, every job has higher values. Try to, so meaning and purpose. What is your purpose? Raising a great, healthy family if you're a housewife? Raising great kids that are going to serve humanity? Mind, body, consciousness, mind, body, spirit, soul, meaning in life, purpose in life, your breath, mindfulness. What are your thoughts that you're entertaining? So basically, this, in a quick sense, I guess, gives you an overview of some of the tools that I use.
Oh, I love it. And I'm having, so many patients are coming through my mind. People are struggling and they don't know why. And a lot of times it is they haven't found what they're here to do. Mark Twain said the two most important days of our life, the day we're born and the day we find out why. And I'm seeing that you turn on a lot of lights for a lot of people. And that might not even be what they originally came in for, but it's hard to get better without purpose.
Thank
Um,
you. Absolutely. Yes.
I'm amazed. It's, we've got a timer on the screen. It's already 30 minutes gone, which is about the time I use for my audience. How do you want to wrap up with everybody? What final message and how can people reach you? You seem like, the whole world should be in contact with you.
Oh, thank you so much. You're so generous in your kind comments. They can reach me through my website, yourvitalitydoctor.com, all spelled out, yourvitalitydoctor.com. Um, and they can call my office 310-289-9770. And my final message, and also my book, Holy You, some of the concepts I talk about, Holy You is on Amazon by Dr. Atousa Mahdavi. Uh, my final message is for everyone to understand that health is a dynamic process and it is not an absolute constant, but it is an ever approaching a state of health that is relative. So if today you don't feel well at all, don't lose hope tomorrow, even if you're slightly better. A year from now, you may be an inch better, but do not lose hope. That's the problem is that sense of depression and losing hope, that fear that pushes people to do anything and take the three meds that your example, for example, your patient, the doctor said, oh, and I have patients that are on 20 meds, 10 meds. Um, so if you understand health is dynamic, it's not an absolute, you start to respect and love your body. That is right now is not perfect. But you know that perfection perhaps is not attained in a short span of time. It's a long term approach. It's a lifetime approach. Don't lose hope. Everything changes. Everything is dynamic. And believe in the power of the body to change, to heal. Believe in the miraculous interventions of the divine, and in the doctors like you and I, many of us out there that can help you.
Well, I've absolutely enjoyed this time. I can tell that you are helping people in more ways than they ever bargained for when they came to see you. You are all of your things, body, mind, and spirit. I'm going to encourage people to purchase Holy You, read it, apply it, create your best life. Dr. Mahdavi, it's been an absolute joy. Thank you for sharing your wisdom with the world.
Thank you so much for having me.